Yeah, straight away I will go to the topic. Uh, I insist on understanding the status of Agni and Grahani and Koshta while treating eye diseases, including corneal diseases, because it is based on the very fundamental principle of Ayurveda. That means while dealing with the Netra Chikitsa, Achakshushe Visheshena Praya Pittanusarina Sirabhirurtham Prasruda. So that is the way in which the doshas are spreading to the eyes from the koshta. So as long as you keep the nidanas in place, I think you cannot get a sustainable result. That is how I am trained. Everybody will be knowing that Jayante Hedu Vaishamyad Vishama Dehadhadavaha Hedu Samyal Samaha. So correcting the Hedu is one of the most important thing. So we were discussing about the different conditions of cornea here. And one important point that I'm doing, especially while treating with keratoconus, we are getting keratoconus cases, not very, though it is not a regular reported case, but very often. So in such cases, we try to divide it into two types. One is having some sort of a presence of agrimandya and the excessive kleda in the costa. That is one type. And the second type is somewhat sahaja type, or which is there from the very beginning. Of course, the diagnosis may get late. And in such cases, the first type, we start with the Krimihara Chikitsa. Krimihara Chikitsa as the baseline treatment. Then only the specific development that has happened in the cornea, that means a Vata predominant Samprati, will be addressed. So the early treatment will be for the Kabhahara and Krimihara Chikitsa focusing the kosta. In the other type, that means the Sahaja Vada predominant type, we will be directly going for the Vada Shamana Chikitsa. And in diseases of the cornea where Vada is predominant in general, I used Shamana Snehapana very frequently. Classical Shamana Snehapana Chikitsa. And in pitta predominant conditions of the cornea, in almost all the situations, what we do is to treat the Agni Dushti, the Vidagdha Pitta, what is formed in the kosta. So Tikta Pajana, Jwarahara, Shobhahara Chikitsa will be adopted as the first line. And generally the medicines selected will be Pitta Kapha Shamana. In this scenario, we use simple medicines like Avipatti Churna, Sudarshana Churna very extensively. And in certain conditions where the cornea is the victim of another samprapti, like see the irritations or erosions caused on the corneal epithelium by conditions, many times occupational, like the computer related issues and everything, we propose Pitta Shamana Chikitsa, most often small quantity of Abhivati Churna, like a half teaspoon or 2 grams of Abhivati Churna 2 times a day with honey, something like that. And we insist on night bandaging with the Krita as Aschodana. Sometimes Madhu and Krita as Anjana. And that gives very sustainable result in almost all the cases. And in certain types of diseases like bullous keratopathy, we put Jatyadi Keram as Aschodhanam in the eyes and suggest bandage. That is an out-of-the-box treatment, but still it works very well. That is what we have learned. Then in most of the conditions where Vada predominance is there and pain is the most striking feature, we go for Kshiradhara, Saindhava Yukta Kshiram, and that gives immediate relief of the pain in Kevala Vata conditions. If there is associated Pitta, we go for Gridabhrashta, Lodhram and Yashti Madhu, which is the classical one. And in Sarvakshigada Rogas, where corneal involvement is there, like maybe in cases of Adhimandha, and severe pain and related conditions with which deprives the patient of his quality of life severely, we opt for Jaluga. And interestingly, certain simple preparations like Shigrupatra Arkam and Arkam made out of the white leaves of that Muscanda frondosa, Vellilam in Malayalam, and some traditional preparations like Tadaga Shukti Kritam, these are giving excellent responses. In general, what I would like to convey, something like a take-home message is, never compromise in the proper assessment of the Agni, Koshtam and Grahani. Take care of them as the first stand line of management, then focus on the local issues and presentations. Thank you very much for inviting me and giving me with this opportunity. Thank you.